Yes, doctors. So again, we will restart this. Okay. Now we will discuss treatments part. Okay, it's a bit longer one. So again, we will spend 10 minutes on this. Okay. So after that, again, we will go for the discussion. Then we will come back and discuss videos on the packages. Okay. Got it? Got it. Okay. So we'll start this. Okay. So now you created so basically now you created all the profile details, photos, about sections, and doctors list, right? So frequently asked question, that is automatically it will fetch based on your information whatever you are given in the profile areas. Okay, so you don't have to bother on that. Okay. Okay, got it. So now we'll discuss about the treatments. So basically, Dr. Palniappan Manikam is a gastroenterologist. Okay, even he can create a gastrology consultation, surgery package. So whatever he wants to create in gastrology, he can create. Even he can create a general package also. There is no bound in his field. Okay, he is super specialized in gastrology, but he can create a basic consultation to anything. Okay, but he can create a package for the physiotherapy. Okay, so you have to create a package for your own treatments only. Dermatologists should create a dermatology packages only. Okay, so if you are so for example, recently we got news, the dentist doing the dermatology procedures, so we won't allow that particular things to happen through Health Mudra. Okay, we are very much strict with that. Don't create a package. We won't yeah, so like, so even if you create now also, in future we won't give that link. Okay, so basically, like, we won't give that patient information to you. Definitely we will so for each patient we are also going to call the patient, ask the feedback. Okay, so first initial call, then a treatment call, then feedback call. So we will collect all the information. So initial call itself we will not allow. Okay, for the patient to come here. Okay, if you are doing some random treatments. Okay, we don't want. So physios should do the physio work, dermatologist should dermatology work. Okay, so that is what we will encourage. We don't want like any sort of problem with this patients, right? Patient treatment, so we don't want to take any risk, we don't want any confusions on that. Okay, so we are very much particular in the treatments. Okay, so let's say okay, so treatment wise, okay, so if you already have the approved any live packages, you can see it in the live area. Okay, so new packages, it's completely in the new area. Okay, so in Dr. Zoli's clinic, I will open and show it. Okay, so we have created some dummy information here. Okay, so we have three branch. Okay, let's say this is Velur branch. Okay, so who's the doctor? So whatever a doctor request is there, whatever approved doctors list is there, you can see all the doctor names here. Okay, so the Velur branch is taken care by Dr. Ranjan Pai. Okay, so just so actually he's the originally owner for some very big branch. So I'm just giving in the random dummy data. Okay, so he is manager for this. I mean, he is the consultant in this particular clinic. So now Dr. Ranjan Pai. Okay, so department. Okay, we will go with the gastrology only. Oh, sorry. We will go. Okay, we will go with the gastrology. So Dr. Ranjan Pai is a gastrologist. Okay, so under gastrology we have fat reduction surgery only. Okay, so this particular fat reduction surgery. Okay, so if you want to add some other surgery or some other packages, you have to come here, you have to tell us to open this particular treatment models, Okay, so particular treatment packages. Okay, for example, if you go with the any dermatology procedures, you will see many, because already we created it. Okay, cosmetic surgery. Okay, you have some things, right? Same thing if you go with any other dermatology things, plastic surgery, dermatology, you will be seeing multiple things, because already we created packages. Same thing if you can't find your packages, just text us, we will create a package. Okay, so icon is dummy one, so in future we will be having more better icon. Okay, so right now I'll go with the gastrology only. Same fat reduction surgery in the Velur branch. Okay, conducted by Dr. Ranjan Pai. Okay, so this is dummy information. If you ask, I mean, if you ask for us to create a uh, packages, we will go with the 100% true information, so you can do it very easily. Okay, so this is the dummy one, so we are going it simple. In case if you are not able to find your option, then you can start typing it. Okay, so you can say I'm not sure which one it is going to go. Okay, cosmetic enhancement, no. Okay, so you can keep that as a one more option, but this I'll put fat reduction. Okay, so click on the enter. This is entered now. Okay, so if you want to go for the cosmetic, okay, cosmetic enhancement, click on the enter, so it automatically selected. Okay, so movement facilitation, EC, or you can say better lifestyle. So you can see this information completely you are going to decide. Okay, so this particular categories we are deciding it. Okay, we are giving this, so we will be giving like a extra two question and answer for you to add your personalized question. And in future we are planning to make it like an order wise, like, so you can reorder however you want. That we didn't decide anything yet, but we can give it. Okay, so that's not a big deal. Okay, so better lifestyle. Okay, so okay, so this, like, you can put whatever things you want. Okay, so purpose of the procedure. Okay, so these are not the right one. Okay, so it's not dummy data, so this data is coming from the admin side. Okay, so this is not the right data, so we will put purpose of the procedure, weight loss. Okay, fat removal. Okay, procedure type, so see, we did wrong. Procedure type is ulta actually, like, so procedure type is surgery, right? Then purpose, weight loss, fat removal, you can mention whatever you want. Okay, visiting place, obviously hospital. Center, if you have surgical center separately, then you can mention such as center, so I'll go with the hospital. Duration of the procedure, so we will mention 5 hours. That depends your procedure. In case if you are treating a stroke therapy, okay, so physiotherapist creating stroke package, then you can mention duration of the procedure maybe 1 hour. Okay, like hospital stay in this area, you can say okay 1 hour, then you can mention okay, so a month, 3 months, 5 months, 10 weeks, so you can extend this. Okay, so as a gastroenterologist doing the gastro surgery, okay, we are putting 5 hours procedure, or we can go with the 3 hours procedure. I don't know exactly, so that is completely in your side, so you can create that. If it is only the consultation, then you can click on the consultation, you don't have to go with this. So now we are going to give the estimation cost. Okay, so usually gastro surgeries will go with the 80,000 rupees to 4 lakhs. Okay, So you should give the estimation range only, don't give the exact number. People will negotiate and people will compare with the different hospitals, so that you may lose uh, some leads also, right? So better you give the average range, okay, not this much, okay, maybe let's say 1,20,000, okay, 1,20,000, 80,000 to 1,20,000, but so it depends, okay. So if it is a tier 1 hospital, so they will go with the 3 lakhs, 4 lakhs. So whatever you want to mention according to your clinic hospital, you can mention that. For a physio consultation, for a regular like a dermatology consultation, you can mention minimum price of 500 rupees, maximum price 3,000, 4,000, whatever it is, okay. Go with the range, okay. Yeah, so hospital stay. So for this fat reduction surgery, okay, so let's say, so visiting 3 hours surgery, okay, so hospital stay, maybe we can say patient should stay for 5 days, uh, patient should stay for 2 days only, do the surgery today, tomorrow you can leave. And it is a short term procedure or long term procedure, better go with the long term procedures. If it is a management, means just like diabetes management and all, okay, you can give the information as much as possible. So we are thinking to prepare one document for this, so how to proceed this. But so whenever you are selecting this particular category, we will be giving the dummy information correctly, okay. So the dummy information will be like already like a 60-80%, the information will be correct only, okay. So directly you can fetch that and you can go with that, and you can edit your pricing and the number of days according to your procedures, right? Success rate, better to mention the success rate, okay. So if not, then we will try to hide that, so anything is fine, okay. So I think whether if you're okay, then you can give it, or else you can leave it also. So success rate, I mean success rate option, okay. So high success rate, you can go with anything, either text or the number wise, okay, or both also you can include. Follow up care, home exercise, physical therapy sessions after the surgery, you have to go for the regular checkup, then suture removals. So you can mention 3 4 information. Insurance coverage, yes or no, that depends completely insurance. So most of the procedures will not cover under this, I mean most of the cosmetic procedures will not come under this, okay. So anyway, this is how you have to enter your details. So apart from this, we will be giving the custom question and answer things in future, okay, maybe in the next updates we will give that. So on that you can write your own question and you can mention the answers also, okay, from your clinic. So basically Dr. Pal is giving, Dr. Palniappan is giving from his side, he is giving, okay, so some Dr. Anjan Pai is going to manage this patient, so they are giving this treatment packages, okay. Click on the save, okay. This particular package is now sent for the verification. Now it is submitted for the review, okay. In meantime, you can create some other package also, let's say Palniappan Manikam. So if he is a ophthalmologist, okay, what is the procedure? LASIK surgery is there, okay. We will not encourage gastroenterologist to do the ophthalmology, okay, that you should aware, okay. So we will go with the endocrinology, okay, Dr. Palniappan Manikam. So gastro and endo, it is there, okay. So we won't encourage this also, that depends, like I'm not sure about this, okay. So you can decide like your own treatments, okay. Let's say now consider Dr. Palniappan Manikam as a physiotherapist, okay. So you can go with the physiotherapy, We have stroke physiotherapy, general physio consultation. So let's say he's a stroke physiotherapy. So the information is the icon is changed. So now the information here it is changed, mobility restoration. So here whatever information he wants to have, stroke, movement, mobility restoration is already written. Procedure type is wrong. Okay, so procedure type should be exercise. Okay, click on the enter, you will enter that. Okay, electrotherapy. Okay, cryotherapy. Rehabilitation. So you can mention whatever is applicable for you. So 3 to 4 information you can mention. Okay, so cryotherapy will not come under this directly, but rehabilitation will come. So you can mention whatever you want. Okay, so after this you can mention the purpose of the procedure. Now you can mention, okay, so mobility restoration, stroke, um, stroke recovery. So you can mention however information you want to give. You can give all the information. Okay, so all these are like a keywords. We are going to see this particular thing. So let's say like Botox treatment. So you are going to see similarly. You are going to see same information. Okay, same information. Okay, like this. Okay, so that is a treatment package details. Visiting place. Okay, so the home visit also available for the stroke therapy. So duration of the procedure, it is a 1 hour duration. Estimated cost, okay, rupee, let's say, so stroke physiotherapy I'm going to charge 600 rupees, maximum I'm going to charge 1000 rupees. Okay, now hospital stay. Okay, there is no hospital stay, but still we want some okay, there is no hospital stay, right? So we'll just try to go 0. Okay, recovery milestone, short term, long term. So definitely long term. Okay, or managements only, so that depends condition. So you can mention long term. Okay, so you can give 6 months to 1 year, 1 year treatment, or whatever it is, whatever you think applicable, you can mention for your treatment. So technology used, electrotherapy, rehab. I mean, you can mention neuro rehab. So all these parameters we will discuss in detail later. Okay, it depends, completely depends on the clinics, doctor specialty, and whatever treatment they are going to use. Okay, so doctors will be deciding it. Okay, minimum success rate, maximum success rate. Okay, so minimum, if you are doing a regular therapy, then you are going to get at least 90 to 95 percentage results. Okay, that's what it is mentioned. Follow up care. Okay, you have to do this home exercise, regular checkups. If you want to write something else, then you can write it. Insurance coverage, yes, many insurance they cover the physiotherapy session for the stroke patients, or sometimes you have to go for the copay. So prior authorization, most of the health insurance, whatever information you want to give, you can enter. Even you can enter your own information also. So you can enter own information wherever it is applicable for you. If there is no dummy data, then you can enter your own data. Okay, got it. Save it. Then this also went for verification. Once verification is done, this is going to reflect in our live package. Okay, so live package, it is not, I can't show the admin panel right now. So I am going to log out from here. Okay, so now I'm showing some dummy data. Okay, you can see from treatments. Okay, so if Dr. Nirupama wants to add some package, she can come here, click on the clinic name, then doctor name, then some cosmetic procedure. Okay, if she wants to add something extra, then she can add, okay, hydrofacial. Then the existing dummy information is fetched. Okay, once you fetch that information, off of the existing information will be fetched automatically, but we will encourage you to give more customized information from your clinic, okay, from your package. So that is what we will encourage. If you want to use the same, then you can use the same, then send for the approval. Okay, so once you are sending it for approval, that is going for the admin panel things. You can see, so this is waiting for the review. Okay, in case if you want to delete, then you can delete. Okay, so now we will see live package from the Dr. Nirupama. Okay, so from Dr. Nirupama we have Botox treatment, laser hair removal, birthmark removal, cryoliposis, all these things already live. Okay, so if you open this I mean, if you open this so if you open Dr. Zoli Skin Clinic, then you can see this live treatment things, right? So all these things already got approved from the admin panel. Okay, so this is what it is. Okay, so if you want more detailed information guidance, then you do the chat. We will help you on this. Okay, so next we are going to see something, videos and the package. Okay. Okay, so now we'll take some questions and discuss that. Then we will see the videos and the package. Then we are done with the early stage product for the health mudra. Okay, yeah, now it's open for the question and answers.